When it comes to scoliosis and the diagnosis of that in a patient, the recommendation eventually ends with something called the recommendation of spinal fusion or scoliosis surgery. Now, unfortunately, this is a very daunting recommendation for most patients because it involves screws and rods in somebody's spine that can actually alter their life forever, whether you're a child or an adult. So most patients at this point are saying, hey, there's something I can do to help straighten my spine, help reduce my scoliosis naturally? And if it is, how do I do that? And that's a great question, and the first thing I want to understand is that if you're looking at this video and you're concerned of, hey, something I can do at home, before you start any treatment process, especially any kind of home program, make sure you consult a professional. Because when we look at scoliosis, there's no two scoliosis cases the same. And just because some exercises work for a patient with a particular type of curve doesn't necessarily mean it's going to work for you based upon your curve type. So always consult a professional when you're looking at scoliosis treatment. At the Scoliosis Reduction Center, we actually focus and specialize in this non-invasive natural approach to scoliosis. And when it comes to treating a scoliosis non-invasively, we're looking at a few things. And these few things tend to be very fragmented in really the natural approach to scoliosis treatment. And let me explain what I mean. Is that most patients, they start saying, okay, I don't want to have surgery. What can I do? So they start looking at different things like exercises and therapy and chiropractic and home rehab. And they're going to all these different doctors and therapists and trying to say, okay, well, I can do this over here and do that over there. And what I tend to see when I first consult a patient is that their care is very fragmented. They're trying to figure something out on their own, and they have this whole fragmentation that they're doing exercises prescribed by one person that are in direct competition with therapy that's being performed by somebody else what's in direct competition with say the chiropractic care that they're getting from a chiropractor, and nothing is coordinated. And I believe this is one of the most special things that happens in Scoliosis Reduction Center is that all the therapy and rehabilitation and exercises and chiropractic and everything is coordinated to work with each other. So nothing is in competition. And when we look at these specific therapy and rehab that we're doing, or how we actually reduce a curve, there are 4 specific things, and that's scoliosis-specific exercises, chiropractic care, therapy, and even corrective bracing if it's needed. When we look at scoliosis-specific exercises, these are exercises that are designed to help reduce scoliosis, so not just general exercises. When we're talking about chiropractic care, we're not just talking about chiropractic care for pain or injury, we're talking about chiropractic care that's specific for scoliosis. When we're talking about therapy, we're not talking about just generalized therapy to help improve range of motion, but actually to help reduce a scoliosis. When we talk about bracing, it's the same thing, not just a general brace, but it's a brace that's going to work in combination to help reduce the scoliosis. So first thing let's talk about is scoliosis-specific exercises. What are these? Well, there's a couple main types. One is something called spinal isometric exercises, and these isometric exercises are breaking down specific regions of the spine to help get a reduction in the scoliosis dealing within a region. These scoliosis spinal isometric exercises are normally done asymmetrically, meaning they're not done the same way on one side versus the other, and they're not going to be very related from person to person, meaning I can have 2 patients with very similar curves may have 2 completely different isometric exercises because the very specific regions of their spine could be very different. There's no way to prescribe these without being properly evaluated, meaning they're going to be determined based upon your curve type, where the angles are, where the apex of the curves are, where the slope angle are, and how we want to affect those. The second type is something called corrective exercises or self-corrective exercises. There's many types of these scoliosis corrective exercises, but they must work in combination with the spinal isometric exercises. And these scoliosis-specific corrective exercises or self-corrective exercises all have one thing in common, that in application of the exercise, they're designed to help reduce the scoliosis by using your own muscles, okay? And somebody will have to train you and teach you how to move your body in a way that's going to actually produce a corrective effect to your spine and not worsen anything else, okay? So that's the scoliosis-specific exercise program. This is very different than general exercises, meaning bicep curls, planks, those kinds of things were maybe good for your core, but they're not having a direct effect on your specific scoliosis. The second thing is scoliosis-specific chiropractic. How does that differ from traditional type of chiropractic? Well, traditionally chiropractic is designed to help restore subluxations. And subluxations are when one bone relative to a bone above or below has lost its normal position and is affecting the nerve system in a negative way, which can lead to pain or dysfunction. Scoliosis is more than just a segmental misalignment. It's a global malposition of the spine from the skull to the pelvis. So using just segmental approaches to help deal with scoliosis normally doesn't have a positive effect or a really drastic effect on the whole shape of the scoliosis, where scoliosis-specific chiropractic deals with the global positions of the spine, and including with the segmental positions, to get the very best reduction in the scoliosis with the possible adjustments that can be performed there. So they're very different than just how you would go about adjusting a patient that has back pain versus taking care of somebody with a lumbar scoliosis in a chiropractic manner. And secondarily is the way it's administered. Most chiropractic care is done very slowly. What I mean by that is a patient will go in very slowly, maybe once or twice or maybe 3 times a week. Maybe the visits are roughly about 10 or 15 minutes, and they do that for a period of 6 months to help rehabilitate the injury they received, and that's what works great. In fact, I've been a chiropractor for 25 years, and I've seen amazing results with patients that have injuries. But when it comes to scoliosis, trying to help reduce a scoliosis with this long traditional approach to chiropractic doesn't have an amazing effect. So what we do is we condense the duration, and we call it intensive care. Intensive care helps us overcome the patient's resistance to reduction in the spine. Okay, that makes sense. It's not that the patient doesn't want to have the curve reduced, it's that the spine is resistant to change. Scoliosis, we know, is not an injury. It's a developmental problem that progresses rapidly during adolescent and then slow progression during adult, meaning so it's very difficult to reduce it. So by condensing the duration of the treatment, we call it intense. Now, intense doesn't mean painful. It doesn't mean that it hurts a person. It means that we just take this 6-month program that you typically would do, like 3 times a week for 6 months, and we condense it down into a 2-week program. And the patient will roughly get anywhere from 6 to 8 hours of therapy, rehabilitation, exercise, chiropractic care, adjustments, all those things that we mentioned, to get a very rapid change in the spine, not slow. Now, what's neat about this is that it allows patients to get care from almost anywhere in the world, because you don't have to live next to me to be a patient. You can come in for a very short duration. We actually go through this intensive care, and then once we do this intensive care, we send you home with all your home therapy, all your home exercises, all the things I mentioned above, and any kind of corrective bracing that you may need, and we co-manage your case with a local doctor who can continue to care for you, and then we just do virtual consultations or consultations over a period of time to actually see the results that are going to be occurring. So the intensive care allows not only local patients, but also patients from far away from my clinic to receive the very exact same care if they were living next door to my clinic, because the results are the same. Meaning, if you live next door to me or you lived several states away, normally what we would recommend is intensive care followed up with home therapy, home rehab, home exercises, and then just these evaluations done regularly, and that can be done virtually. So you can see there's not really any difference in results. In fact, majority of my patients are patients that are actually flying in and traveling in, staying with me for a short duration and going back. In fact, these kind of results are very common. And in this type of care, we normally are receiving 25 to 35% reduction in patients' curve size, and actually getting the curve to reduce to get a very good result. In fact, you can see many of our testimonials on our website, how these reductions actually work and how they work with patients. So there is a way to reduce your curve naturally, but it must not be fragmented. It must be very, very specific. It must be inclusive of all the things that I mentioned. And of course, don't attempt to try to do this at home without having your spine completely evaluated properly, because you can be doing something to actually make your scoliosis worse. And that's something that I don't want to encourage you to do. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.